Hi everyone, welcome back to another part of Introduction to Anatomy, which will be part 5 about systemic anatomy, and specifically we will take muscles, or called myology. And as the next lectures will be, we will discuss upper limbs and lower limbs, and most of these limbs are consisting of skeletal muscle, so it is okay to take myology or muscle tissue from a school of systemic anatomy. Muscle tissue will be one of the 4 primary tissue types of the human body, as you remember before: connective tissue, epithelial tissue, muscle tissue, and nervous tissue. Muscle tissue will be discussed at this part or this presentation. Muscular system. A word muscle reflects and raises the idea of skeletal muscles that move the human body and hide the fact that muscles are part of other systems such as cardiovascular system, digestive system, genitourinary system, and integumentary system, etc. And even we hear these words by our ears due to favor of muscles, I mean extrinsic and intrinsic muscles of hearing, as seen in this slide. We have more than 600 muscles in our bodies. They together constitute about 40 to 50 of our body weights. Our bones and joints by themselves are unable to produce movements. They need muscles to move. The science that steady bones called osteology, science that steady joints called arthrology, the science that steady muscles called myology. There are 3 types of muscles. Skeletal muscles only will be discussed in this presentation, and some features about these skeletal muscles: they are the most abundant tissue in the human body. They attach to the skeleton at least at one point or one end. The great majority of them is under voluntary control, and their vital function in movement, respiration, and heat productions. The other muscles which will not be discussed here is the smooth muscle and cardiac muscle. Only skeletal muscle will be discussed. In this slide, you could see the attachment of muscle to the bone by its tendon. In this slide, we see a blue area and red area. At your practical books, the red area represents the origin of the muscle, and blue area represents the insertion of the muscle. As I mentioned before, each muscle must attach at one end to the bone, and also must cross a joint to produce its action. A summary for the function of the skeletal muscles: it have a role in motion, posture, example head and trunk. They have a role in protection, as in the muscles of the anterior abdominal wall, and thermogenesis or heat production, and vascular pump. They regards as the peripheral heart to the human body. The red meat of the butcher represent the skeletal muscles. Naming of the muscles. In this slide, you can see the various types of vehicles. They could be classified according to their size, shape, or their function. The same thing could be applied to muscles. They could be classified according or named according to several factors. We could depend on shape and size, location, attachment, action, number of heads, and joint involvement, as seen in the following slide. Regarding the joint involvement, we have muscles that cross single joint, we have muscles that cross double joints, and we have muscles doesn't cross any joint. These are called mimicry muscles. As seen in this slide, you could see this muscle, this group of muscles cross just one joint, and the other, which is situated more medial, cross two joints, the hip joint and knee joint, while the other, which are situated more lateral, are crossing the hip joints only. Other factor is we can classify these muscles according to the depth. We call it superficialis or profundus. Other factors are which part of the body affected by the action. Other factor is the extent of attachment, whether short or long. And now I will give you some examples about muscles which are named according to their shapes, such as trapezius, which is like a trapezium, rhomboid, which is like a rhombus, deltoid, which is similar to delta, and latissimus, which is a broad, and teres, which is cylindrical, vastus, which is also broad, rectus, which is straight, quadratus, which is triangular or quadrangular, in shape, piriformis, which is pear-shaped, semitendinosus, which is like a tendon, platysma, which is also broad, serratus, which is serrated, lambricals, which is a worm-like muscles. The shape depends on the arrangement of the fibers of a given muscle. Muscles that are named according to their size called major, which is large, minor, which is small, maximus, medius, minimus, magnus. Muscles which are named according to their location, such as interossei, which are located between the bones, supraspinatus, above the spine, lateralis, to the lateral side, medialis, intermedius, femoris, and gluteus, and lastly subclavius, which is situated below the clavicle. Muscles which are named according to their attachment. Attachment, I mean attachment of origin and attachment of insertion, such as coracobrachialis, sternothyroid, tibialis, sternocleidomastoid, mylohyoid, and carpi. Muscles attached to skeleton to produce locomotion, but others may attach to organs like eyeball. Others may attach to skin like facial muscles or muscles of facial expression. Other muscles attached to mucous membrane like intrinsic muscle of the tongue. Muscles which are named according to their action, such as levator, supinator, pronator, flexor, extensor, and sartorius. Muscles which are named according to the number of the heads that they have, such as biceps, which have 2 heads, triceps 3 heads, quadriceps 4 heads, etc. Other muscles which are named according to the body, which are affected by their action, such as digitorum, which affect the movement of digits, halluces, the big toe, and brachii, the brachium, pollicis, which means muscles that affect and move the thumb. Other muscles are named according to the extent of attachment, whether short and long, such as longus and brevis, which are mostly used for phalanges or muscles that move the phalanges. Another classification which is depending on the arrangement of fibers of a given muscle. The arrangement is established in respect to the tendon of muscle. I mean, whether the fibers are parallel to the tendon or at a right angle to the tendon. We have two types, parallel and oblique. Such muscles are, or such classification seen in this slide. Convergent, fusiform, parallel, unipinnate, bipinnate, multipinnate, and circular. This classification, parallel, the first one from the left side, parallel mean the fibers are parallel to the tendon. Fusiform, which takes the spindle shape. Unipinnate mean the fibers are attached to one side of the tendon. Bipinnate, which is a feather-like, the muscle fibers are attached from both sides of the tendon. The differences between parallel and oblique. The parallel fibered muscle maximizes range of motion, while the oblique fibers maximizes force production. This means that the oblique fibered muscle have more force production than the parallel fiber, which have more range of motion. The range is more here, while the force is more here at the oblique muscles. As seen in this slide, this is not very important, but I want you to look to this red line. More tension or force, but smaller range of motion. This is regarding the pinnate muscle. We have unipinnate muscle, fibers on one side of the tendon. Bipinnate, fibers on both sides of the tendon. Multipinnate, tendon branches within the muscle as seen in these figures. This slide showing you the direction of contraction force. These muscles have more range of action. The other figure reflects more force production. Why? Because it has increase in the anatomical cross-sectional area as seen in this figure. The naming depends on classification, whether it is microscopical classification, which is depending on the architectural features, and macroscopical classification, which depends on the shape, overall shape of the muscle. So if we depend on microscopical classification or architectural, we have parallel fibered and oblique fibered, and the oblique takes three parts or three divisions: unipinnate, bipinnate, and multipinnate. And if we depend on macroscopical classification or the shape, or depending on the overall shape of the muscle, we have flat, fusiform, quadrate, circular, or called sphincteral muscles, multi-headed, and pinnate muscle. Muscle attachment, the origin. The muscles usually attached at the 2 points to the skeleton of the human body. The first attachment point called origin, which is more proximal or proximal end of the muscle, which is less mobile, while the distal end of the muscle is called insertion, and it is more mobile. Another topic is the types of muscle contraction. We have reflexive contraction. We have three types of contraction, three types of muscle contraction. We have a reflexive contraction, which is done by a reflex called automatic contraction to voluntary muscles, such as muscles of respiration and stretch reflex by the medical hammer of the doctor. The other one is the tonic contraction, which is a slight muscle contraction during relaxation or tone. It does not produce movement but maintaining posture. The third one called phasic contraction, which is active contraction. This type that produce the movement or locomotion or movement of the human body, which consists of two divisions. The first one called isotonic contraction, in which muscle changes its length and produce movement. This is called isotonic. While isometric contraction, in which muscle does not change its length and no movement happened, but the force or tension of the muscle is increased above tonic level. This is isometric contraction, in which example for the contraction of the deltoid muscle, in which the deltoid holds arm in its position, so-called isometric. As I mentioned before, no change its length and no movement happen, only the tone of the muscle increased above its level. So this is called isometric. And the other one in the middle, the other figure, also deltoid muscle shortens to move the arm. Shortens, I mean the muscle when it is contracted, the fibers will become short and produce contraction and movement of the shoulder joint causes, at this figure, abduction of the upper limb or abduction of the arm, called concentric contraction. Eccentric, the deltoid lengthens to lower arm inferiorly. Muscle, another topic is muscle relationships or relationship between muscles. The first one is agonist, or called the prime mover. I mean the muscle when it contracted and produce the movement, this is called the agonist. Antagonist, the muscle that reflect or reverse the action of the prime mover or agonist and causing reverse action of the prime mover, this is called antagonist. Anti means opposite. Like for example, latissimus dorsi muscle adducts shoulder and it antagonizes both deltoid and supraspinatus. Other example is the biceps muscle, which causes flexion of the elbow joint, which is called the agonist or the prime mover for the flexion of the elbow joint. While the antagonist muscle for this action is the triceps, which is situated posterior to the arm or posterior to the humerus bone. The third type is a synergist. Syn means the same. Example, supraspinatus muscle, which assists deltoid muscle in shoulder abduction. So they are synergistic or synergist to each other. This is the end of my presentation. Thanks for your listening.